Hello, good evening, good afternoon, good morning, wherever you are in the world. Hi, I'm Dr. Philip McMillan. Thank you very much for joining me. This is really an interesting discussion that I'm going to have, and it's one of those impromptu ones. And so I appreciate the people who are being involved with me. Just to give you a background, there was a preprint paper that came out about looking at an autopsy report on a person who died. One of the authors I happened to have interviewed, so I'd reached out to her to see if she would be willing to speak with me about it because I plan to speak about it anyway. She managed to get in contact with all the players. Sadly, she can't join us today, so it's Jancy Lindsay. And so I have with me today not just myself talking about the paper, but one of the main authors, and we have another author, and we have the mother of the person involved. So this is really a tremendous opportunity to look at and reflect carefully on the implications from a scientific point of view, but also the personal implications when we think about it. So I'm just going to add them into the screen here. So I'll probably start with Ed. I'll ask Ed to give us a quick introduction. Then I'll ask Heather to give a quick introduction, and then I'll ask Hetty to give an introduction and the background as to why we are where we are now today, if that makes sense. So, Ed, would you like to go ahead for us?
Sure. I am an internal medicine physician. I practice primary care clinical medicine in Jacksonville, Florida, and essentially I take care of patients. And that is what got me involved in first treating COVID patients and later treating the COVID injured patients, the COVID vaccine injured patients, I should say.
Excellent. And Heather?
Yes, hello. My name is Heather Hudson, and I am the mother of Cody Hudson, who is significantly vaccine injured. He also has a peer-reviewed paper. I met Dr. Balbona because I was having trouble getting help to have his diagnosis completed and to get him treatment. We started working together somewhat and doing some writing. I ended up writing a Substack on these issues. And then I met Hetty while I was giving a Zoom presentation, and we started working on getting some answers for her son's fatal COVID-19 vaccine death.
Wonderful. Thank you very much, Heather. And Hetty?
Yes, I'm Hetty Simoes, and on May 6, 2021, I became a bereaved mother when my beautiful son Victor died in Seattle, 3,000 miles away from his home state, from his parents, whom he loved, from his family. He was working there remotely. He had a high level position and was there temporarily just looking for places to live. And so on that day, when on about 16 days, he took the COVID shot on April 20th, and on 16 days later, he died of an aortic dissection. It was sudden. I had been speaking to him the day before. We were laughing. He would call me 4 or 5 times a day anyway. So there was nothing for me he wasn't sick. He was actually dancing with his girlfriend the night before in celebration of a promotion she had gotten. And then on the morning of May 6th, I got the phone call that every parent dreads. Hetty, Victor has passed away. I dropped to my knees. I yelled. And it's been a nightmare ever since. And so, because to bury your child is the worst thing in the world. And so we knew there had to be something wrong. It was just incomprehensible. So they did do an autopsy. They found that he had died of an aortic dissection, but nobody in the family had aortic dissections. The pathologist recommended genetics to see if there was something in the family. We had his DNA tested twice in different labs to make sure. Both of them came back with there wasn't any collagen deficiency disorder. There was nothing that would lead him to have had this. We had our whole family tested. Every member of the immediate family was tested. So when all that came back, we knew it wasn't that. In addition, the ER doctor suspected that he had a pulmonary embolism just because he died so quickly. He died probably within 2 hours of calling, 911. So he thought it was a pulmonary embolism, and he actually asked his girlfriend, did he have the vaccine? And she said yes. So that clued us in that, the vaccine would very likely be the culprit. And we set out we spent over 2 years trying to find the evidence that would lead us to conclude what was the truth behind my son's death, what caused my son's death. And that truth has just come out in the paper that you have before you, which has been a journey of talking to numerous people, having lots of research done, and it's been, we can talk about all of that as you wish.
Wonderful, wonderful. Thank you very much, Hetty. I think one of the things that I realize as I listen to you, and Heather, I think you'd have had a similar issue. When problems were found, were you surprised at how difficult it was to get any attention? Any thoughts, Heather, from your experience with your own son?
Yes. So I'm going to digress a little bit because my older son has spina bifida, and I had worked in the hospitals in California for years, and I saw what the hospitals did when children were sick and when they needed help. And so when Cody ended up sick, I was expecting that same level of care and attention, and it was anything but. We were treated as if, we weren't telling the truth, and as if, his case was unimportant. He was given an actual slap on the back by a cardiologist who told him, just get out and start running again. He had an active pulmonary embolism, and he had a significant life-threatening autoimmune disorder that they didn't even look for. And I knew that he was extremely ill and that he had not been diagnosed. But we went to 3 hospitals, a total of 3 hospitals. I believe it was 2 urgent cares, 3 specialists. And then we finally started to get some answers when we met Dr. Balbona, who did testing in conjunction with a hematologist. And now we have confirmation by at least 3 different physicians on his vaccine injury, his life-threatening vaccine injury.
Wow. And so it brings us back to you, Ed, because you're clearly in a minority, a group of doctors who are willing to ask questions. And I understand how the industry works. You're doing this at great risk. What made you start looking at this in the first place, Ed?
I never thought I was doing anything unusual. A patient comes to me with an illness. What you do is you think about the patient, you look at their presentation. I've seen many pulmonary embolists in the past, and there was something else going on here. It's obvious. I am in solo practice, so to some extent, I'm sheltered from the groupthink that was taking over medicine. And when a patient came to me, I did what I think was proper and normal, and you do the best you can to sort out what's going on and make the patient better. I was really surprised that so many other physicians created silos of possibilities that just could not be explored. So, Cody's case, his problem started after exposure to an experimental vaccine made with phospholipids. He was having a tremendous clotting problem, and we know there's one of those clotting problems is antiphospholipid syndrome, where you have antibodies to these. It seemed very logical that might occur, and nobody was looking for it. It's very similar to the myocarditis case with Victor, that if you don't ask the questions, if you don't look for it, you're not going to find. And there's been this, I don't know what else to call it, but groupthink that we are not allowed to look, to ask, to take care of the patients. And I just never got the memo. I just kept doing what doctors should do.
That is brilliant. That is exactly what I would hope would come out of some of these discussions, is that everything is on the table. There is nothing that is off the table. And it brings me back to you, Hetty, because at the time, I think I remember listening to your initial when you were sharing about it. You mentioned that the whole family was vaccinated. So you were, and the family were pro vaccine, pro COVID vaccines. How surprised were you? This is the bit I'm trying to understand. How did your thinking change when you saw what happened?
Well, you have to understand that we live in New York. New York was ground zero. Every day, the governor was telling us 1,000 people died. Today, another 1,000 people died. So everybody was in deep fear, including my son Victor, who visited us quite often. Um, my husband was hesitant. And he was, but it was very hard to find the information we needed to make an informed decision. There were some doctors speaking out, but they were immediately squashed. And then, you're left with, well, do I go with these, what they called fringe doctors, or do I go with the doctors, the FDA, the CDC, who we've always had a trust in, which now I've learned we shouldn't be trusting them, but we've had a trust in, our government agencies to do the right thing. So we were conflicted. Yes, we all took the vaccine, but we were somewhat conflicted. But the fear that we experienced and the keeping us in our homes, unable to talk to our neighbors. I mean, one time we went to, wish my mother happy birthday. She lives 10 minutes away. We had to have signs outside just waving to her from her, she's at the door, and the whole family is arriving just to wish, because it was so crazy that you couldn't even go wish your mother a happy birthday. My son Victor was an amazing person, but he also started to experience some of the fear, but he questioned. My husband questioned the most. He says, I'm not so sure we should do this. He was reading about the ferrets that were dying in, here in, I don't remember the study. But he did not want to be the one, quote, to be responsible for the death of grandma or grandpa if we didn't get the vaccine, because that was a very, very powerful propaganda that they used, and they knew it was going to be powerful. And so every time, for example, my husband went to Costco or anywhere, and came home, took off the clothes, took the showers, whatever, my children would still say, but don't go there, don't go anywhere, because you could bring home the virus and we won't even know it, and we could go visit grandma and we'll give it to her. This is the kind of fear we were living in that caused us to lose our critical thinking, because people with a lot more common sense did not take the vaccine. And therefore, we dropped our guard. And Victor was the last in the family to take the vaccine. I actually was first, and I wish I had had a reaction that would have caused everybody else in the family to stop. But we were not in that environment. Everybody else, did you get the vaccine? Did you get the vaccine? Did you have did you set up your appointment? It was like a frenzy, especially in New York. I sometimes say, I wish I had lived in the hills of Appalachia and didn't know anything. Not that they don't know anything, but what was not engulfed in this whole, New York City kind of, environment. So excuse me I love Appalachia. So anyway, so I was just trying to make a, go to the hills. And actually, Victor, he was so nervous about it. He had gone to be with his girlfriend who was in another state. And he was actually looking for rental homes for us to leave New York and go there, because he was thinking that we were all, things were going to happen. So anyway, to make a long story short, we took the vaccine, but it wasn't without some, caution. It was more, we didn't know what the right answer was. And then, you just kept hearing about people dying and all this. And you said, well, I guess this is what we have to do. And this was the fatal mistake we made and everybody else made, because this vaccine did not save anybody. That's not true.
I'll just because I'm trying to make sure that we're balanced, what I'll say here is that I knew at the beginning who was high risk. We all knew the characteristics, the comorbidities, the age. And when you said protecting grandma, that was technically what they were saying. But somehow, after, and I think that the US led the way on this, they somehow decided to vaccinate the whole population. I am very happy to have somebody explain to me how they came to that conclusion, looking at the characteristics of the at risk groups and the fact that we didn't know all of the outcomes. I think that's where the huge mistake was made, where low risk people were then brought into that cohort without us understanding fully the risks around an immune mediated disease. So it's interesting to get the thought here on Ed. What were your thoughts at the time? And because I think it's important. A lot of people are criticizing doctors, but we genuinely were trying to do the right thing.
Um, I think once it was obvious it was not stopping transmission, and the case for the vaccine was really had no foundation. Vaccines are unique in medicine. Normally, when we're treating someone who's already ill. So we're trying to make them better. With vaccines, you're treating people who are fine. They're good. So you have to justify the risk of any vaccine against, the risk of them becoming ill. For many groups in our population, their risk was negligible. It was essentially zero. And much of the normal studies that would be done to prove safety were not done. So if you ask, where did the vaccine go? Well, we were told they just stayed in the arm for a couple hours. That's not true. There were no biodistribution studies in human to say this is where it goes. Well, how much spike protein does the vaccine make? Well, we still don't know. And I suspect it varies dramatically with the patient you give it to. And I suspect the young make a lot more of it. Now, treating the vaccine injured, we're doing serologies of spike titers, and they're in the thousands. I mean, they're making a lot of spike protein months and months and even years after the vaccine. So, how long does that spike protein last? Again, we don't know. The norms in medicine is that our agencies prove something is safe. It's not that we prove it isn't. That's it's on its head. There is not proof that these vaccines are safe. Just from that basis, they should not be used. They shouldn't be used, especially in the low risk.
Yeah, I think I'd certainly agree with you. And Heather, just before we move on towards the paper, based on what we've been just saying, what are your thoughts and your experience?
Well, what I've seen, I've done quite a bit of research, and I don't know if you know this, but my research is used around the world. It's used in Germany, it's used in Australia, it's used in a case in Texas, and more. And so what I've seen is that the investigations aren't being done to bring to the public what is happening with the vaccines and the vaccine injured. And so if the research isn't done and the documentation is not completed, we really can't know what the risk to benefit ratio of any medicine, any drug, or any vaccine is. And I think that the public has not been asking that question. Where are the studies and where's the documentation, and why aren't the governments doing it?
Excellent, excellent. So what we'll be doing next is that we'll be looking a little bit of this at this paper. So this is a paper that was is a preprint, a case of myocarditis, pericarditis, and fatal aortic dissection following a COVID mRNA vaccination. And so you can see here that the authors are Ed, Heather, and Jancy, who couldn't join us today, but has been previously with me. So it's a tremendous honor to have them all here with me so that we can actually go through the paper and try and make some sense of it. So before I start, I thought it would be wise to just use a few images to help the audience to know what we're going to be talking about. So here we have an image of the heart. And so I've just put these together with BioRender so that you have a clear image of it. This is a normal heart, and you can see these are the ventricles, these are the atria here. In blue is usually the venous blood. This is venous blood going from the right side of the heart. And the area that we're interested in is this here, the aorta. And then you can see the branches going up towards the arm and the brain here. And this is the same heart with a cut section, and again showing this left ventricle with the aorta here, the aortic valve. And this is the aorta that would then go down the rest of the body. And this is what it looks like from the heart. So you have the heart here. This is the aorta. This is just showing one of the three branches, the axillary artery, but all of the blood coming to the body. So it has the highest pressure from the heart, and it's a very, very muscular organ. And when we look at it, this is a normal aorta or a normal, very thick artery with this lining on the inside, the intima, and then the muscle layer. And then they have a lining on the outside as well, a fibrous like lining. And in a dissection, this is usually ripped either from the endothelium, which is lining here, or through this. And then the blood can then go down through the layers and then sometimes break all the way out and then cause a massive hemorrhage. So this is just a little bit of baseline. Anything I left out there, Ed, that you think I
No,
probably should?
that was
Mhm.
excellent. That's correct.
Great. So now that we have that there, let's just step back a little bit. And when did you start looking at this paper, Ed?
Hetty, you might have to help me. I want to say,
It was over this,
ago?
well, it was over this summer that I came to your office
Mhm.
with Victor's medical records and all of the reports that I had, the genetics, the toxicology, which was negative, the serum analysis report. And you started looking at that and you realized right away it was a vaccine injury because you had treated people. And also you realized that Victor was normal. And, I didn't at that time have the tissue analysis, but you said you would help me and you would take this on, and I'm forever grateful. And you would look at this and and write up Victor's case study, of course, with Heather's help and whatever. But it was what I wanted, because I'm not letting my son's death be in vain. He was too important. And I'm just going to say one thing, Dr. McMillan. Many people may look at this case and they may look at, before Dr. Balbona speaks, well, yes, he may have died, but look how many people we saved, or if the greater good. That concept of the greater good does not sit well with a mother that has lost her child. It is not rare when it's your child. And to those people that say, well, it's for the greater good, I say, well, which one of your children are you going to be willing to give up for the team? That's what people have to think about. This is a mother and a father and a sister and a brother that has lost their beloved brother, who was an amazing person, and son, brother, to everybody. And you cannot just flippantly say, well, we saved lives. Give me your child. Let your child die. And then let me ask you if you still feel that way. I'm sorry. I just had to make that point. I'm sorry.
And
Go ahead.
that is an excellent point, Hetty, and I appreciate that making that, because many people, you're right, can easily discount how important this is and think that it's just one off. It doesn't matter too much. It is a child. It is a life that was lost. And as researchers and scientists, we should be doing everything in our power to understand and reduce the risk for anyone else. So thank you very much. So let's pull in the paper here. So essentially, so he was 34 years old in good health, and this is the important bit: 16 days after his first dose. So people would argue, Ed, that he is not vaccinated because he wasn't 14 days after the second dose. What
So,
do you think about that?
well, I think that's an arbitrary delineation to try and get some of these harms moved into the unvaccinated category. The peak at 2 to 3 weeks. That's exactly when he had this horrible event. Uh, Once you have the vaccine, it starts affecting your immune cells. It starts causing inflammation. part of that is intentional, but in the case of this vaccine, many of the consequences are not intentional, and the group it's being used in is very low risk. We are lacking discretion, discernment. We're using the vaccine indiscriminately. It's not wise. So this young 34-year-old was not helped by this vaccine. And there was a good case before he got the vaccine that he had no risk of COVID to speak of.
Mm-hmm.
These people are just being harmed. In Florida, there's actually a warning to young men under 39, don't get the vaccine because your risk of myocarditis is much higher than your risk of COVID.
Mm-hmm.
Part
Yeah.
of my interest.
If I may,
Mm-hmm.
I just wanted
Go
to
ahead.
say that even the co-developer of the lipid nanoparticles, Peter Cullis, and his writing in 2020, about 4 months before the vaccines were rolled out, noted in that particular study on the biomolecular corona that this is not a one-size-fits-all therapy. Even the man who developed or co-developed the LNPs wrote that it wasn't a one-size-fits-all therapy, and it just isn't. It's not for everybody.
Yeah.
So
Mm-hmm.
on review of the case, it became very obvious that he was harmed by his experience with the vaccine. And there's just really not an appreciation that this can happen. We're not looking for it. We're not doing autopsies. We're not doing cytokine studies. And the biggest, hope is that bringing cases like this to the attention of the media and of physicians will change that dynamic. So we need to create an awareness that it isn't all benefit, that there are risks, and those risks need to be weighed against the vaccine benefits. And for many, for children, there are no benefits. There's just risk. And it's, in my opinion, unethical to continue to keep vaccinating these low-risk groups.
Yeah, I agree. Yeah. So when we look at the other thing that you have highlighted in the abstract, so this is just the abstract, although the incidence of such complications are believed to be low, we propose that information gaps exist in the criteria and findings that inform both public health agencies and the public on the incidence and even severe myocarditis and cardiac adverse events. What exactly are you meaning here with that?
So, again, because of the efforts of Hetty, his mother, we have a lot of information about what actually happened in Victor's case. I'm seeing many cases where that information is not available, and we're not searching for it. And the same cytokine information doesn't have to be done on autopsy. We can do it in the people who are vaccine injured, and it's not being done. The same inflammatory changes are present in the living, and we should be doing these studies. We should be identifying that it's actually spike protein, that's the pathogen, that's the mechanism that's causing harm in these patients, and working to find answers for these patients. It is almost like the old military slogan, don't ask, don't tell. We're not asking the questions. We're not telling the patients. We're not having normal discussions in the medical community on how to help these patients. If the vaccines worked, you can only die once. The people died of COVID. We should be seeing mortalities going down, plummeting, because all those people who are at risk are gone. That's not happening. The vaccines are not working. Mortality rates are going up. Some would say in an unexplained manner, but we have suspicions that it can be explained. You just have to ask, you got to look. And part of that is gathering the information. Part of the goal of this preprint is to encourage people to open their eyes and gather the information they need to understand what's really going on in their patients.
Yeah.
Also,
Okay.
when you mentioned autopsies, Victor was autopsied. However, they did not do a histological study of his tissue initially. I had to actually go abroad and have his tissue examined histologically abroad because no one in the United States would do it. I couldn't find anybody. Heather looked, Dr. Balbona asked around, other people I knew asked around. It was like they just didn't want to touch it with a 10-foot pole. There was, so we are at a loss because if I had just left it with the autopsy that was done, I would have believed my son died from an aortic dissection, unexplained, and I would never have the truth. And now we have the truth. I would have not done the cytokine study. I would not have sent his tissues abroad for investigation. This took a lot of work and the help of a lot of people. And I'm forever grateful for them. But it was a lot of work that my husband and I had to ramp up and become, what do we do next? What do we have to do? Let's go here. Let's call this one. Let's ask that one. And it was not an easy journey, but if you don't do it, you don't have the answers. And
Hetty, you touched on something there. I'd like to ask either Ed or Heather about why would the pathologists, separate from the coroner, why did pathologists not want to do the histology?
Who would have thought in American medicine that we'd have such a culture of fear and intimidation and coercion? I mean, the attacks on physicians who are only trying to help their patients, I think are just obscene and unethical, and the attackers need to be put into the light of day and say, what's your agenda here? These physicians are going out of the way to help people, and what are you doing? I mean, we just accept the slogans and the coercion and the intimidation and the othering of people who have been injured. And I find it just very unethical that for Duke University not to help someone because they're unvaccinated is unethical. To separate people by vaccine status, to not do investigations because we don't want to find the answers, that's not defendable. That's not correct. That's not moral. And at some point, we need to take back the profession of medicine and say, listen, doctors need to be free to be physicians who care first and foremost for their patients, and not employees of big corporations that have their own agendas and can be intimidated and coerced and destroyed. We've seen too many good physicians destroyed for the crime of caring for a patient who's ill. That is something I never believed I would see in my entire career. I'm in solo practice. I'm hard to kill. I'm hard to hurt. I mean, and there have been attempts, but the fact that people would want to hurt me for caring for a patient, I find shocking. It's just, whether it's the media or whether it's the medical institutions or the hospitals, that they would, the insurance companies, that they'd come at, physicians who are doing the crime of caring for patients with such just vengeance, just hatefulness, is something we should not accept. That's not the kind of medicine you want anywhere in this world.
Yeah. And to his point, I'll just say that, I belong to Compassionate Friends. This is a group for people that have lost children. I met a mother there that's a pediatrician who lost her son to a brain cancer, not to the vaccine. And when I spoke to her about my son, she said, of course it was the vaccine, and a tsunami of information will come out eventually, but we are being, I don't want to use the word threatened because I'm not quite sure if that's the right word, but and I heard this from another friend of mine whose doctor actually showed her the letter. They're getting letters. I'm not saying everybody, but they're getting letters to please not spread misinformation about the vaccine. And of course, that's in its own way is a subtle threat. Don't say anything against the vaccine, otherwise, you may come. They may have to, be reprimanded. I just wanted to make that point.
I would like to say something too, if you don't mind.
No, go ahead, Heather.
So I had contacted very well-known physicians, even ones that have their own television shows, and pathologists from coast to coast. I had doctors and physicians helping in the US, Canada, and England and Germany, trying to find a pathologist that would do this work for Victor, for Hetty's son. And it took months and months. And I even asked a friend of mine to be an assistant for me. We formed a little network trying to get this done. The information that is given on Victor's histopathology report is vital, and it's rare. And like I said again, I will say it again, without having that information and that documentation in all of these cases, you cannot know what the risk is. There's no way to tell.
Yeah. So let's just take a look at something here. So we then go into the case presentation. 34-year-old male in good health. As we said, 16 days after the first dose, he experienced acute inflammation. So sudden thoracic aortic dissection and pericardial tamponade. That's where the blood goes around the heart and the sac around the heart, leading to death. Sorry to ask this, Hetty, but from the time of onset of symptoms to when he died, how long was that?
Well, of course, I was not with him, so I have the information from his girlfriend and from the medical records. He, I think he called. He called the. He was feeling chest pain and jaw numbness. What happened was he called probably around 1:30, and then when he knew that EMS was the medical services was arriving, he woke up his girlfriend. He says, "I'm not feeling right. I'm gonna get checked out at the hospital, but don't worry, I'll call you." So he went downstairs, and ironically, he went back for his mask. I don't think he made it all the way downstairs, but he went to the elevator, went back for his mask, went downstairs. They started checking his vitals. His girlfriend arrived, and he introduced her, and then he collapsed. So I think he was, but so they probably arrived around 10 to 2, something around that. Around by 10 to 20, they were on their way. He arrived at the hospital at 2:26. That I have from the medical records. And then he was declared deceased by 3:15 a.m. Seattle time, which was
Right.
6. Yeah. So it was very quick. It was very quick. As I said to you the day before, we were laughing, we were talking to each other twice. He went out, he was dancing with his girlfriend. They went out to dinner. He didn't feel well after dinner. He had gastro issues, but that also is typical of what starts to happen with an aortic dissection. But of course, he just had, he probably thought he was just having indigestion or whatever, and went to bed. And then I don't know exactly when he started feeling the pain, but obviously he got scared. And his girlfriend said his watch, Apple Watch, when she looked at it, the heartbeat was at 190 beats per minute.
Wow.
So it was
And
very quick, very,
very
very
quick.
quick.
And so, Ed, I think that practically, I would suspect maybe you can have quite a tear. Usually there is quite severe pain at the start, and the speed of deterioration with a dissection could be very, very quick. So that does fit. Any thoughts about that, Ed?
Yeah, so much of the evidence is from the autopsy. So you can see the intimal tear where there was a pocket formed where the blood moved into the adventitia, and then it started to dissect across the aortic arch. As it dissects, it actually forms a bubble in the wall of the aorta, so it starts to block flow of blood there. And then as the dissection gets bigger, it weakened the wall into the pericardial space. That space was filled with blood. And once that happens, the pericardial sac does not have a rip in it. So it becomes this rigid box around the heart that as the harder he beats, the more it fills with blood, the more it squeezes the heart so it can't move. And that as you know, is pericardial tamponade. It's followed by a cardiac arrest. And
Mhm.
from that moment on, it would have been hopeless unless they had opened up the pericardial sac. And that would have been a very difficult thing to suspect. And we would not suspect aortic dissection in a 34-year-old. It's just extremely rare. Generally, you see these in 60, 70-year-old men with lots of vascular disease.
Yeah. And I think that there was, oh, sorry, go ahead, Hetty.
No, that was my point that, unless, yeah, you may hear occasionally of a young man having aortic dissection, but almost 90, 100% of the time, it's because afterwards they do find there's a genetic link. Victor did not have a genetic link. So that, and also another point that I did specifically ask the coroner if he had had an aneurysm, because, that, and he did not. And he also said that there was no evidence of high blood pressure in his heart. So it was like, and when I showed his all this information to cardiac specialist and aortic specialist, they basically said that if he had walked into their office the day before, they would have given him a clean bill of health. So this is a tragedy that I lost my son when he could have been here had he not taken the vaccine. Do you know how angry that makes me? And I'm not going to speak much more about that, but you can imagine, to lose a child is a nightmare, but then to know it was because he did something that he was told was safe, and now he's gone, and my life, my children's lives, we're going to feel this effect for the rest of our lives. I won't have his grandchildren. I won't have his, grandchildren. His brother and sister, they were dreaming of all having children together and the cousins playing together because they were all at that age. This has ripple effects that people don't understand when you lose a person that you love. And to lose that person in this manner, it's very hard for me to process.
Yeah, I really appreciate that, Eddie. As I said, I really appreciate you sharing this because it's so much more when it comes from you as opposed to us just talking about it. The reality of the message really comes through. So now I'm going to be taking back to Heather or Ed the paper. Now, here is the bit that I think people need to understand. Now, I have been arguing and pressing for the longest while that we need autopsies. As far as I'm concerned, without autopsies, and I don't mean just an autopsy, an external organ autopsy, I want histology. I need histology in order to understand what is going on inside the body, especially from an autoimmune perspective, because you will only see that with histology. So I'm going to come to the histology here now, Ed, and I just want you to talk us through it here. So this is the bit that you had to go to Germany to get. Nobody in the US would do this histological examination. How long after was this done?
I think it took us about 2 years to even start. I mean, I knew that was what it took about I think 2 years, a little over 2 years before we made contact with Germany. And of course, then we have to send the tissue over. The tissue has to be, properly prepared. And well, it was prepared. So it took a long time. And then, the person, that did it, they had to have the time to do it and do it right. And then write the notes about it. It took a long time. I can't remember exactly. But
I think it was about 2 months since the pathologist actually received it until we got our first report on it, and then the slides and such and the notations took somewhat longer. It might have been about 2.5 months, had he said, from when he had it to when the work was actually completed.
What I was interested in is from the point of his death to finding a pathologist to take on doing the histology. That's the question I'm curious about. That would have been maybe 1.5 years.
So Dr. Burkhardt's laboratory had already published papers where they were looking for the spike protein in the heart and had developed the techniques to do it. So we knew he had the experience and expertise to do it. Again, because I believe of intimidation, pathologists here, I mean, they're all working for someone. They're all working for institutions and hospitals. Really feared to step into this arena to even look for the spike protein in the heart. The CDC has a study out today where it admits that since the vaccine came out, myocarditis has increased over 100-fold. I think it's a 13,000% increase in myocarditis. That's a big coincidence, and that was not present during COVID. That's only present since the vaccine has been available.
Mhm.
Yeah.
I think the larger issue is we're still doing it. It hasn't stopped. We're still potentially harming young men, we're harming children, we're harming pregnant women. And again, the onus is not on grieving mothers to prove the vaccine's not safe. The onerous, the standard of care that's always been our standard is vaccine manufacturers and our medical institutions, the FDA, have to prove it's safe. They haven't done that, and we're allowing that to continue.
Yeah. So when we look at this here, it's very clear. So finally, when the histology is done, so they look at the heart and the pericardial sac, they show lymphocytic infiltrates
Yeah.
indicative of pericarditis and myocarditis, as is seen in other pericarditis and myocarditis cases that they've seen. So this part is what we have seen before. The
Mhm.
bit here that is important is that there is also eosinophilic infiltrates that were present in his arterial tissues, consistent with a hypersensitivity response. So this is the bit that certainly from my point of view, I want to see. I want to know whether or not this is occurring across a number of people with disease, because you can only know this on histology. And that's the bit that I think people don't get.
Yeah.
It's not good enough just to do the autopsy if you haven't yet also done this bit of detail to break it down to show, because without this question, you don't go on to then look at the spike protein. And this is now then looking for the presence of spike protein in the aorta as well as the vascular tissues, but an absence of staining for nucleocapsid antigens, indicating that the spike protein was vaccine derived. Is there anything that people could challenge on with this to say that this was something else?
So the spike protein is very specific to COVID-19. We have two sources of that: the virus, which also has nuclear capsid. We would expect if it were the virus causing myocarditis to see the nuclear capsid in the tissue, so we do not. And then the vaccine, which only gives us spike protein. And that's what we see in his tissues. That when we stain very specifically for spike protein, that nothing else does that. This is new. It's new to this world in the last 4 years. Then we can see the little brown specks you can see on the slides. Those are actually staining for spike protein. So we know this is from the vaccine. We know the vaccine, at least the spike protein, is present in his heart. We also know that the heart has inflammation with the eosinophils and the lymphocytes. So yeah, I don't believe it's outrageous to presume that the spike protein is the source of that inflammation. Perhaps the lipid nanoparticles as well, but the presence of the spike only makes us know it's only the vaccine. The presence of the inflammation, you can say that there could be another thing going on we aren't appreciating, but in an otherwise healthy gentleman with no other underlying health problems, in this setting, I think you have to come to the conclusion it really was the vaccine that led to the inflammation that took his life.
So this is a slide, a histological slide
Hmm.
from his this is from his aorta.
Yeah.
And just so that I make sure that I've got it right. So the arrows here are pointing to this is spike protein in brown that we're seeing.
Yeah, that's horseradish peroxidase standing. Yeah, in the brown,
Yeah.
that's the spike protein antibodies.
And spike protein here as well.
Yes, sir.
And this is in the blood vessels
Yep.
that are supplying the muscle and the lining of the heart
It's
that have
called the
got the.
vasa vasorum. So
That's
they're
right.
the blood vessels that supply the artery itself. If those are inflamed, you can see how it could compromise the integrity of the lining of the aorta and lead to the aortic dissection.
Mm. Any thoughts as to why those arteries or those vasa vasorum were targeted? Did they, by any chance, look at any other blood vessels, or was it just really the aorta?
They looked in the slides that we have at the aorta. I think there probably is a component of the size of the vessels that the inflammation seems
Mhm.
to be in smaller vessels. Uh,
Hmm.
and it may be the smaller vessels are less capable of taking that inflammation in stride, that it causes more obstruction, more injury. And at least that's what I tend to see in my vaccine injured patients, that they have a microvascular problem and very small blood vessels. It's very difficult to see. They don't have a macrovascular problem, which is what we're used to seeing and what our tests are designed for.
Yeah, that's an important point. Just as Heather, because you've been doing a lot of research around this, any thoughts to add in here?
Well, so Victor's slides included what was it, Hetty? The liver, the heart, the aorta,
Brain, all the
brain.
things. Yeah.
And this is where we saw the spike. So it wasn't seen in the other areas. It was seen here. And from personal knowledge from my son, I know that it is the smaller vessels that have affected him. And he's fighting for his life still at this point. So I'm intimately familiar with that and do quite a bit of research and work with many doctors that they're seeing the same, like Dr. Balbona is saying, the smaller vessels.
And Heather, just to what is it that you have found in that journey with your son? Because it's one thing when the person has died, people then walk away, but when the person is sick and still presenting, are you finding that the majority of doctors are still ignoring the possibility?
He was just hospitalized throughout most of the winter. Some of the doctors spoke to me freely about the fact that this was a vaccine injury. Other doctors wouldn't speak on it. They just worked with the actual symptoms. I did get more sympathy and a greater level of care for him, because he's developed a very significant autoimmune disorder after his vaccine, and there's quite a bit of research done on that by Dr. Schoenfeld, who's very well known and who has done work showing that even the COVID-19 vaccine can bring about the autoimmune disorder. So it's a little bit better research than some of the other areas, like myocarditis and autoimmune are better research. But also, because I have the history that I have, I can speak with them and explain to them that shows the autoimmune disorders that in drugs like Onpattro was connective tissue disorders that were linked to the lipids, and the lipids are the similar lipids that are used in this COVID-19 vaccine. So being able to explain that to some of the doctors and explain that we've already seen this before for quite a long time kind of gives them a history and something to look at. Sometimes they're very interested and they want to see some of the research, and sometimes they just listen, and that will ask questions, which tells me that we are starting to see a little bit of a turnaround. But in Cody's case, it is acutely evident that he is struggling for his life. He was 21 when he entered the hospital. He had his birthday in the hospital. This was in the year 2021, and he ended up walking with a cane. He's had 2 strokes, and he currently has narrowing of the veins in the entire left side of his brain and more. And this was a 21-year-old man who was running at the gym for 5 miles, at least 5 times a week, and he was full of life. And he just fell and crumbled to somebody who's now been ordered a wheelchair by the hospital doctors, and almost lost his battle recently. So I think it's acutely evident that this athletic young man didn't just suddenly, fall ill, for no reason. There's something behind it. But the work of Dr. Schoenfeld and Dr. Rosella Tolada and some of the other doctors has already paved the way for what happened to Cody. So we have some evidence to bring forward. Also, as Dr. Balbona said, his lab work told the tale. His antibodies were to the phospholipids, and that is what was injected into him.
Wow. This is a nightmare scenario, Ed. You know, um, there is not going to be any easy get outs of this, because the thing about autoimmunity is that once it gets going, it does not really go away. It's all we do is manage it. And so if we don't understand and if we don't mitigate, the implications are quite horrific across the population.
We have to start investigating. We have to start understanding resistance better. And I, I I don't know why doctors aren't looking at cytokine panels. They exist. Insurance should be covering these investigations. Um, if a patient comes to you and they need help, doctors should just be free to be independent doctors. I mean, this top-down government control of everything. I know that's the case in England and in Europe, but we're not familiar with that. It's very shocking to us, and I'm very aware of the things you lose if you don't let doctors be independent, use their training and their minds, and investigate all these cases that have died within weeks of a COVID vaccine. There should be automatic autopsy and cytokines and histology and investigation. That should be the standard of care. And our hope is that will be the standard of care, because it's obvious that we're missing many cases of harm. Again, if the vaccines worked, we should see plummeting death rates. We're seeing the opposite. Okay? And no one's dying of COVID anymore. They're dying of these strange other things that seem to be inflammatory in nature. They seem to be thrombotic in nature. They seem to be vascular in nature. And that happens to be where the vaccine is having a lot of its problems.
Absolutely. Let's just pull into the conclusion of the paper here. So you have here that myocarditis has been portrayed as a rare complication of the COVID mRNA vaccination, but this may not be accurate. Studies show that when sophisticated techniques are used, such as the troponin assays, the MRIs, PET scannings, that these injuries are far more common, and even in asymptomatic individuals following the mRNA vaccines. This is one of the things that I'm very, very concerned about, is that people could have long-term injuries, be largely unaware of it, but it doesn't mean that damage is not still being done. And so, until, as you said with the cytokines, until we start actively screening, like what we do in most diseases, we do HbA1c for diabetes. You check people's blood pressure regularly to see if they're hypertensive. We check their lipids. Until we have the ability to screen for the people who could be at risk and may not even be aware, we are going to be causing long-term harm to the population.
I agree completely. My concern is that there are many more cases of asymptomatic subclinical myocarditis that have left scars or fibrosis in the heart tissue that at the right point in the future can be a focus for arrhythmia that unfortunately can be fatal. Those patients are completely unaware that their heart's been damaged, and it may be years before we see the results of that.
And when some studies that we have referenced in the paper looked, because they had these same questions, they were actually seeing them in the patients in the cohort that they had selected. And it's surprising to me, because this was even in the very young.
Yeah. And again, as of today, the CDC is saying that the rates of myocarditis have exploded. They're not going so far as to say it's because of the vaccine. But again, that merits investigation. We should ask the question, why has this happened? What is different since 2001? And if there is some kind of suggestion that there may be a relation to, in our case, the mRNA vaccines, is it really justifiable? Is it moral? Is it ethical to keep giving these indiscriminately? I don't believe it is.
Mm-hmm. There's a bit here at the end of the paper that I really want to highlight. In depth, histopathology at autopsy upon death of apparently healthy individuals after COVID 19 vaccination, as well as advanced cardiac testing in all patients with cardiac symptoms, such as chest pain and shortness of breath after vaccination, should be performed to avoid future patient harm and better inform public policy. I think that the biggest failure that I have seen is the lack of autopsies. I guarantee you, history is going to show that if we had been diligent at doing autopsies around younger people dying unexpectedly and just looking for the histopathology, because as far as I'm concerned, we would have found vasculitis all over the place. That would have been the flag to say we have got a problem.
Yeah.
I'm still struggling to accept that the medical community would go along with some kind of strategy that they don't benefit from just because of pressure. It's really sad to contemplate.
It's as if they don't want to find or hear the answer. The technology that's being developed is actually amazing technology, but it has to be used with discernment, with wisdom, with um, you know, being judicious with it. Giving it to everyone willy nilly is just not defendable, and not looking for the answers of these cases that we know something horrible, catastrophic, unexpected happened. We need to find the answers so they don't happen again, so they don't keep happening. And unfortunately, I think at this point, it's still happening to innocent young men and children. I mean, we just need to stop this from going. And we need to just have a moment of reflection. What are we about? You know, are we here to just be corporations printing money, or are we here to care for patients and move science and knowledge forward? You have to ask the right questions to get the right answers. And we're not answering, we're not finding those questions, we're not looking for them. And I agree with you. If we look, we will find the right answer. Maybe this, I'm mistaken. Maybe what I think is wrong, but we should look. We should investigate. We should understand. That's always been the position of good scientists and physicians, and we've abandoned that. We need to get back to it.
Absolutely. I'll just read the last statement down here. The benefit risk appraisal of COVID 19 vaccination is determined by public health agencies who are expected to inform the public of emerging safety data as it is made available to afford complete informed consent. And the public should also expect that each emerging safety concern should prompt timely regulatory investigation and actions that are important for public health. So I'm going to ask each one of you, don't worry, I'll start with Heather, then Ed, then Hetty. I want you to say your closing comments about where we are, what you hope for, and what you hope to achieve from what you're doing. So start with you, Heather.
Well, I would like to see education. I would like to see physicians educated without them having to be in fear of speaking out of their findings. Because once they're educated and they start looking, if they do have findings, they need to be free to say what they have found. Again, we really don't have any answers or conclusions without having that evidence, whether it shows that these people were injured by the vaccine or not. We need to know how do we make any statements that it's rare or that it's safe without knowing that. So that's what I would like to see. I would like to see physicians educated and have them not have to be in fear of presenting their findings.
Excellent, excellent. And Ed?
I think we're at a moment where if our agencies and our public health system is going to maintain any credibility, they have to start to really be open and honest. Uh, the evidences they've delayed and hidden the evidence of myocarditis when it was brought to them, and when they first got the signals, again they did not report it in the usual fashion. It was suppressed. The data now, the CDC is suppression. The harm that they're doing to our healthcare institutions and our faith in medicine is just devastating. They don't, this is not healthcare by tyranny. We need healthcare by trust. And I hope that the uh, public agencies entrusted with caring for us and safeguarding us will pick up their responsibility and be honest with the American people, be honest with physicians, and stop censoring, stop sitting down and having a debate will go a long way. Having open and honest debate, that's how issues and problems in medicine are sorted out. We do it by sitting down at a conference room, say, present your case, I'll present mine. Good luck. Okay. But we need to be honest. We need to be open. We have to ask the right questions, and we have to have uh, the ability to gather the pertinent information, which is currently being suppressed. I think you're right. Autopsies and histopathology is key.
Yeah, wonderful. And Hetty?
Um, you know, there, in order for us to have a medical system that is working, there has to be a certain level of trust.
Yeah.
The trust in the medical system has been destroyed, at least for me. Early on, they said, we are looking for the signals. Supposedly, they had the VAERS program was going to alert them, and they were going to be diligently watching anything that would be, submitted to VAERS. And if there was a signal, if they saw that people were dying, unexpectedly, that they would address it. Well, I reported my son to VAERS because the hospital didn't do it, even though they were federally mandated to do it. The doctors aren't doing it. The hospitals aren't doing it. I did it. And that's VAERS is really underreported. You have a different system. I believe it's called Yellow Card. I'm not sure. But anyway, so I reported it. It's maybe 1 or 2%, of the true numbers. I reported it. I did not get a call back from VAERS. Nobody contacted me about my son's death. I thought immediately they would be interested in learning what happened to this young man. I wanted to speak to the doctors because I thought maybe they would have experts and be able to tell me what happened to my son. At any rate, I never got any. So I called them, and and I was a little bit hysterical. And I said, people are dying around me that I'm speaking to. What's going on? So they sent me a form condolence letter, basically stating that the vaccine is safe and that's been well tested and all of that. So I said, I don't want to say what I said, but I was very angry with that letter. So I called back again and I got the same thing. And then this time they're also recommending that I maybe want to go for, so along the grief therapy along those lines, right? So I felt totally dismissed. Here I am, a mother that just lost her son. Her government is telling her the vaccine is safe, even though, I have no answers. They're dismissing me when they're not telling me about what's really going on. They're just giving me form condolence letters and basically recommending therapy. So from that day on, I completely have lost the trust of the FDA, the CDC, the NIH, and all of our government agencies. I don't believe I'm the only one that has lost trust. Once you lose trust in your agencies and your medical system, you're not going to have a viable medical system. I am just one mother that has lost a child. I know many mothers that have lost children or have, as Cody, or are injured. And it's just not mothers. 15 minutes from me, I know a wife that lost her husband to HLH. It's documented in the BLJ. So there are hundreds of thousands of stories, if not millions. So we're not going to sit back and be told it's safe and effective and think we're going to be trusting you in the future if anything else comes up. And that's basically how I feel.
And I thank you all very much for coming and speaking about this. And it reminded me, as I look at where we are today, this is 2024. When I started to see the things happening in 2022, I never imagined that we could still be in a position where people are still asking questions and still pushing back. But the lesson that I think I would say, if there is a politician who is listening, if there are people in the industry, pharmaceutical industry, who are listening, just remember this: the mothers, the wives who have lost loved ones, will never forgive you and they will never stop looking for you. This is not going to end until we have some clarity for the future. And we have to seem as though we have to build a new base of trust for medicine and health because we need trust in the context of what we do. And I think most doctors do want to do the right thing, but something has gone wrong in the pandemic. We need to look and analyze why and then try and be better for the future. So thank you all very much for being with us. And I'll just ask you to wait with me while we do the outro. And thank you everyone for listening to our presentation today.
Thank
Thank
you.
you for having me.
Thank you, Dr. McMillan.
Thank you.
Thanks.
Thank you so much.